This PLAB2 scenario is a communication skill station for counseling. Mrs. Patricia is a 68-year-old lady who came with weakness on left side of her face and aphasia that are resolving within 2 hours. Her blood pressure now is 170 over 100 millimeters mercury. Talk to her husband and take history and explain management. As you can see, you will not be meeting this lady in the station. Deconstruction of the question suggests an old lady who has transient ischemic attacks as symptoms are resolving. She also is found to have a high blood pressure. So you are mainly counseling her husband, explaining what is happening, taking history. You will obviously be taking history for past medical history and also risk factors, and then you will explain the management of transient ischemic episode. So like any station, you will first start with your grips, greeting the patient, establishing who he is, ensuring confidentiality that you are talking to the right person and not someone else's husband. You will also be explaining to her current situation. For example, if he's asking about how is his wife, you could say that other senior doctors are attending to her and you have come to take some background details. Now, there are 3 main chunks of counseling. The first is history taking, in which you will explore the current presentation. You will ask about the present illness, when did it start, the onset, how long have the symptoms been, what is the progress of the symptoms in sequence. You will inquire about any recent illness that may have precipitated any warning signs that she had for the last day or two. After open-ended questions, you will ask some more specific questions about symptoms of TIA or stroke, about vision loss, dizziness, difficulty in swallowing, weakness of arms or limbs, and unsteady gait. Then you will take past medical history, any chronic health problems, any similar episodes in the past medical history, and does she take any regular medications. That is one chunk of the counseling. The second is establishing risk factors for stroke. You knew that blood pressure was high today. You could ask whether it was ever checked before, or whether she is already on antihypertensive medications. If so, how regularly is she getting her blood pressure monitored? Then inquire about smoking, how much, since when, if she is. Similarly for alcohol, is she a regular drinker? Is she dependent on alcohol? Inquire about her dietary habits. Has she ever had her cholesterol checked? How active is she, and is she regularly active? And family history of stroke. All of those would be a background risk factor for stroke. You could also keep in mind the ABCD2 score. Final part of the station is management. Explain to the patient what is TIA. For example, you could use words like this is not a full stroke but like a mini stroke because symptoms are completely resolving. You could mention that doctors use a tool called ABCD2 score, and based on this patient's age, duration of symptoms lasting more than 60 minutes, and the fact that she has high blood pressure may put her at a higher risk. You could discuss the risk of stroke. If examiner is there, you could mention that you will need to do a full examination, including neurological examination. Explain to the husband that she will be needing investigations, including an ECG, as sometimes disorders of the heart structure or rhythm could predispose to stroke. You would do some blood investigations. You would be thinking of brain imaging, a CT scan or a MRI, and you will also be arranging ultrasound Doppler of carotids. You will initiate her on medication called aspirin to prevent clot formations, and you will make a referral to the stroke team or the neurologist service. While you're talking, obviously husband will have questions and you will be answering those questions to get a closure. So essentially in such a station, you will be expected to cover history taking of the current presentation, including background history, assessing risk factors, and then explaining the management.